Okay, this is Sherry. Let me see if I can get started here. Case study number 2 for Nursing 602. This is a 52-year-old female, white Caucasian. She is at the clinic for a cough and shortness of breath, and this is her initial and episodic visit. So the HPI is she has a non-productive cough with occasional shortness of breath for over 1 week. Her symptoms began as typical allergy symptoms, and they turned into a cough several days later. The cough has been persistent. She does have a history of seasonal allergies, which she says she currently has, the postnasal drip and sneezing. She denies fever, stomach ache, earache, sore throat, night sweats, chest pain, or a headache associated with these symptoms. She says the symptoms they're really not worse, but they're not getting any better. The cough is just irritating to her. She's eating and sleeping fairly well, except for coughing spells that she said are increasing in length. So she starts to cough and kind of just coughs and coughs and coughs and seems like she can't get her breath or kind of, and then that gets over and she thinks she's fine. The shortness of breath is more of an irritant in her chest than truly not being able to get her breath. I think it's more like when she's coughing, just a tightness in her chest. The cough is in the sternal area without production of sputum. It does hurt when she said her chest is getting so it hurts more during coughing when she's coughing. And she has phlegm that's cleared with coughing. So there's secretions in there, but she's not really coughing anything up. And she said, like she may feel gurgly, whatever that in her chest, but when she coughs, then she clears it. HPI, doing the old cart here. I like to do this, just another view of it. Approximately 10 days ago, it began, like I said, with the postnasal drip and sneezing. Then it's progressed to that tightness in her chest and coughing. She's coughing a lot. Sometimes the coughing spells last for like 5 minutes. Again, non-productive. Phlegm is present, but really she coughs, clears it. Nothing really helps it, and nothing really makes it worse. She is taking her Singulair and Zyrtec, which she has prescribed, or she takes that kind of when she has allergy symptoms. So she's been taking that, but really nothing else. And like I said, she said nothing really is making it worse, but nothing. It's not getting better, and that's why she's at the clinic. She said she just keeps hoping every day she'll get better. She feels like she might be getting better, but it just stays there. Family history: her mother's 75, alive, and has COPD. Father's alive at 76, and he has Parkinson's. She has a brother 56 with hypertension, and then a sister 54 with hypertension, and then a younger sister that's 48 that she said is healthy. She has one son and two daughters, and they are healthy. She's married with 3 grown children. She works as a school counselor. She's a non-smoker, and she denies alcohol or drug use. She had bronchitis a year ago, does have a history of depression and anxiety for many years, and you'll see in her medication she has something for that. Also has hypertension going along with the family history there for about 5 years, she said, and then, like I said, she has seasonal allergies. She had C-sections with all 3 of her children, and then had a hysterectomy. I don't have a date on that, but obviously after having children and up till now. She had a stomach tumor removed in 2010 and a colectomy in 2012. She is allergic to dairy products and eggs, and for that reason is opting not to get the flu shot, the yearly flu shot. I'll put that in here because I may forget to say it later. Up to date on her immunizations. Her last tetanus shot was 5 years ago. She has the Zantac that she takes for anxiety. She said she doesn't take that very often. She's has changed jobs recently and is a lot less anxious. Said her kids are grown now and doing good, so she doesn't have the anxiety with that. So she has that prescription and occasionally is anxious, but not doesn't take that very often. Propranolol for her hypertension which is very well controlled. She takes Prozac every morning for her depression, and then, like I said before, the Singulair and Zyrtec that she takes. The Singular she takes regularly, Zyrtec only when she has her allergy symptoms. Review of symptoms. She is generally very healthy. She said she has had no change in her weight. She's eating and sleeping good other than her recent coughing spells. No rashes, birthmarks, abnormal bruising, or skin lesions. She said she doesn't have headaches, no history of head injuries or seizures. She sees good. She wears glasses and sees an optometrist yearly. No pain, redness, or draining with that. She does say sometimes with her allergies she has like watery eyes, but today and actually recently hasn't had those symptoms. No history of ear problems, difficulties hearing, or vertigo. She denies stuffiness or nosebleeds, changes in smelling. She does have allergies. She said her allergy symptoms right now are mild, I think, in comparison to the cough. But does have some postnasal drip and sneezing. She is taking her allergy meds, so she said that helps with those symptoms. So she doesn't know if they're not as bad or just because of the meds it's not bad. She sees a yearly dental, I think I spelled that wrong, put an extra T, yearly dental exam. No problems with her tonsils, sores in her mouth, swallowing, hoarseness. She said her throat's a little bit irritated right now, more so just because of coughing spells, but not that it hurts or it's sore. It's just irritated, she said. Neck is supple with actually, that's my assessment. Her neck she denies swollen or tender glands, no pain, good range of motion. Breasts, no lumps, bumps, discharge, or any changes there. She does do regular self breast exams. Respiratory, looks like my formatting changed here. No history of asthma or pneumonia. She did have bronchitis last year, like I said before. She does right now have a non-productive cough with occasional wheezes and tightness in her breath, in her chest. Her heart, no congenital problems, no shortness of breath with exertion as far as her heart. She does have hypertension, which is well managed with the medication. GI symptoms, she hasn't had GI problems other than she did have that tumor that was removed 5 years ago. Other than that, no abdominal nausea, diarrhea, constipation, any problems there. No problems with urination, burning urination or frequency. No genital itching, rashes, or pain. She did start through menopause a couple years ago, and so that seems to be going okay so far. Musculoskeletal, she denies any problems with her bones or joints, movement, difficulty walking or coordination, no history of broken bones. She has not had any tingling, weakness, numbness, fainting, loss of consciousness, or seizures. Endocrine-wise, denies thirst, hunger, urination, fatigue, sensitivity to hot or cold, or excessive sweating or excessive hair growth. Her physical exam, again, she is really in no acute distress other than coughing. She was clean and well nourished, with a very hydrated appearance, dressed appropriately, and answered questions appropriately. You can see her vital signs here. Skin is smooth, soft, no rashes, supple skin, like I said, well hydrated. Head normocephalic, no pain. On palpation, cranial nerves are intact. Pupils equal, round, and reactive to light. No redness or swelling, no drainage. She doesn't really look like she has allergies type symptoms right now. Tympanic membranes for her ears are clear. She does have some clear drainage and tenderness as I palpate around her nose and her sinuses. They're mildly tender, she said. Mucous membranes are red and moist, a little bit edematous. She her mouth and throat pharynx looks good. It is a little bit red, pinkish, I guess, just from the cough there. Good gag reflex. Like I said before, her neck is supple. No masses, lymphadenopathy, discomfort in movement or swallowing. She has normal range of motion in her back and her spine, moves well. Her lungs are clear to auscultation. I heard no wheezes, even though she said she's had some wheezing. No egophonia, that's important to the diagnosis. No intercostal retractions or use of accessory muscles, and she does have that non-productive cough that kind of comes and goes. She said she had one spell of that in the office where she got to coughing and drank some water and then seemed to be fine. Heart rate and rhythm are regular without murmurs or rubs. Abdomen is soft without tenderness, active bowel sounds, no CVA tenderness or abnormalities with her abdomen. Like I said before, she moves all extremities well, no swelling or tenderness in her any of her extremities or joints. She's alert and oriented ×3. Cranial nerves are intact. Reflexes are good. Negative Romberg. Good sensation. Everything's normal with her neuro exam. Genitalia breasts are symmetrical. No distractions. Discharge. Sorry. No lymphadenopathy or pain around there. We did not do an external or internal genital exam just because she wasn't there for a physical. So laboratory data for her diagnosis, which should come before the lab part. We think she has bronchitis, and per Butero et al., there's no lab tests to diagnostic. It's diagnostic based on symptoms. We ruled out other medical conditions. I would recommend a chest x-ray later if her symptoms worsen or change significantly to make sure she doesn't have pneumonia, and just to look for any other abnormalities there. Differential diagnosis, she could have asthma, a foreign body, aspiration, pneumonia, SARS, tuberculosis, tumors. Again, her diagnosis is acute bronchitis based on her symptoms. She doesn't have a fever. She doesn't have the egophonia. She doesn't have crackles or wheezes that we heard. And she is not very fatigued and just short of breath all the time. So, bronchitis is an acute infection of the trachea and larger bronchi characterized by cough. Actually, acute bronchitis can last up to 3 weeks, and then there's chronic bronchitis that can last, or actually is characterized after 3 months of these symptoms. Most cases are viral and do not require antibiotics. The epithelium of the bronchi are inflamed and then become damaged, just a short-term change there. They release that pro-inflammatory mediators that then cause narrowing, capillary dilation, increased mucus production, loss of ciliary function in there, and swelling. So just that inflammatory response. The cough can be productive or non-productive. She could have had a sore throat, low-grade fever, postnasal drip, which she does have, that substernal kind of aching pain. But no changes in breath sounds, no egophonia, no crackles or things like that that would lead us to think maybe she either has asthma or pneumonia. The plan of care, the USPSTF recommendations are for cervical cancer and HPV screening. She did that, covers that in her yearly exam. Blood pressure screen, which we do monitor, and that was within normal today. Alcohol screen, she denies alcohol use or abuse. She had chlamydia, gonorrhea, and HIV screen years back, probably with her pregnancy and around that childbearing time of life. Refuses any of that now, is with her husband that she's been with for a long time and said she's not at risk for, she's been tested and doesn't need new testing. Does have a history of anxiety and depression. She seemed very fine today. Like I said, takes her medication and did not act or verbalize depression. Lipid screen, she has completed, I think, yearly, and she would, when she had her yearly exam, they did the labs, they did all that, and they were within normal range for her. She's not on cholesterol meds, so she must be doing good there. And she did have a colonoscopy 2 years ago, and it was normal, so she knows about kind of all those routine screen things and is taking care of them. Health counseling just for herself today, which is covered, I think, on the next slide. Good eating habits, vegetables, fruits, proteins, limiting sugar and salt, avoiding caffeine and stimulants, more probably blood pressure type control, and depression, not overeating. Her BMI is a little bit high. We didn't talk about that because my provider really focuses on why they're here today and at a annual exam to cover like all those routine or things that you really need to get them to change habits on. So the plan for her is symptom management is the key thing. They do not recommend antibiotics unless she, persists to be sick. If they did a sputum culture and found out it was bacterial and she wasn't getting better, then maybe antibiotics would be in line. So what we recommended for her was just some cough medicine to take to help her with the coughing spells, and probably more so at night to help her so she sleeps better and isn't awakened and coughing, but also that she could take in the day if it's real bothersome. Ibuprofen for just discomfort. If she needs that, she probably won't take that. Increasing fluids and extra rest as needed just to help her get over this. It's probably a virus and it's going to take some time. We talked about that. It's going to take some time to get over it. She just needs to try to be patient if she can, and also come back if the symptoms get worse. And specific with that is if she starts to cough up sputum, more sputum, and coughing up things, if she develops a fever, if she has more shortness of breath, not just with the coughing, wheezes, or crackles that she notices she can hear or feel, increased heart rate or chest pain, anything really that's worse than she is right now, to come back. And we probably then would do a chest x-ray, make sure she doesn't have pneumonia or something else going on. Probably I would give her a bronchodilator, and that's a question that I had that I'll add in here. She is actually on a beta blocker for her blood pressure, which is not the first line recommendation. And I'm not sure why. I didn't question that because I'm a student. You just trust the providers. Also wondered about lisinopril, which is an ACE inhibitor, is the first line that my provider likes to use and one of the first line recommended through the JNC 8 recommendations. But a side effect of that is cough. So, because I thought, well, maybe she has this cough partly because of the medicine she's on, but she's actually on a medication that beta blockers that typically don't have cough as a side effect. So if she was on the medicine I would put her on, I guess I would question if maybe her cough could be agitated by the ACE inhibitor, but she's not on that. And then also I would be cautious because she is on a beta blocker for blood pressure, putting her on a beta blocker, albuterol or something like that for shortness of breath, just to make sure we don't mess things up. So I typically feel like, I guess, if the blood pressure medicine she's on is working for her, we can leave her on that for now. I would like your feedback on that if I'm wrong, if she needs to be changed. And then also about, potentially giving her albuterol, if she continues to have the shortness of breath, if that's appropriate or not. Again, knows she needs to follow up if the symptoms get worse. We always tell them if you have any problems or questions about anything to call or come back to the office. And these are my references. Thank you very much.